Hey everyone, I wanted to come back on for another Lunch and Learn series. We are today going to be talking about the social determinants of health. And so I know you're probably wondering why are we talking about this particular topic? Well, this really is a culmination of looking at your life as a whole, and that everything works together. And so I wanted to just hit three really quick points. I try to make these a little bit light but interesting so that way it can spark the conversation. And so we're going to look at how you would describe some specific social determinants of health that create and perpetuate health disparities and inequity. We are going to discuss some key findings related to the social determinants of health and their effects on health outcomes. And we're going to identify some specific strategies to be able to determine or to address the social determinants of health related inequities and disparities. So, as always, I repeat who I am, what I'm doing, why I'm doing it. So my name is Karen Malone. I am the founder and executive director. I apologize, there's a car going by. Founder and executive director of Rehab Your Life. I have a bachelor's of science in workforce education, training and development, a master's of science in rehabilitation counseling. I'm also a certified rehabilitation counselor and a certified community health worker. And so my motto is, in order to rehab your life, you have to renew your mind. So most of the things that we do through Rehab Your Life is really challenging you to change the way you're thinking and to renew a renewed spirit within you to be able to create a new vision and move forward towards that vision. So I always like to start with an icebreaker type of question. I know it's not really interactive. You can put in the comments if you would like the answer to the question. But how many people know what social determinants of health are? And again, there's no right or wrong answer. If you want to participate, go ahead and put your answer in the chat or the comment section. And so 98% of people that are not in the healthcare field actually do not understand or know or can identify the social determinants of health. So that's where we are going to start. So the social determinants of health are, looking at, like I said, a person holistically from a healthcare perspective, an educational perspective, economics, social and community interaction, and also where they live. And so all of these things come together to be able to see how well someone is functioning within their community. And when these things are lacking, it creates and perpetuates health disparities and inequity across the board. I know you've heard of some statistics where they say in a lot of low income, people of color neighborhoods, on every corner there's a liquor store, or they don't have a grocery store where they're able to get fresh foods. And so through Rehab Your Life, when we're talking about being able to set some goals and, rehab your health, rehab your relationships, etc., if you don't have these things available to you, it is going to perpetuate some of those disparities and inequality across the board. So that's why we are focusing on being able to identify those and letting you know that we are definitely sensitive to that when we are working with you and building your rehab action plan, because we work with a lot of individuals in a lot of different communities. And so you may have someone who lives in the suburbs, but you also may have someone that lives in the city. So recommendations that we might provide have to be sensitive to the area that the person lives. So this is a way of just sharing information with you in reference to our knowledge base and knowing that we are taking all things in consideration when we are working with you. So let's dive into just a couple of the points. Economic stability is definitely a topic that is on everyone's mind these days. We just received those stimulus checks, and as a community, as a world, a nation, we needed to be able to put a little bit of emphasis on the economic stability or instability that we were experiencing due to the pandemic. And so when you step back from the pandemic, though, all of these things already always existed. Choosing where you live and what neighborhood you lived in, the job that you have and how far you live from that job, and or going to school. Are you taking classes online, or are you going to, a physical school location? Having the availability of transportation and access to health-related needs. And then also looking as a whole, what is the exposure level to pollution, crime? Are you being discriminated against in your community? Have you experienced trauma within your community? And also looking at a person from their physical and emotional health perspective. So economic stability plays a huge part of being able to bring someone up and getting them into a healthy state. And when we don't do that, it really causes some health consequences when someone is persistently in a state of poverty. So persistent poverty prevents access to secure shelter, education, healthcare services, food, and it actually harms the family stability. Poverty takes a daily toll on the poor and those who are often stigmatized. And the effective interventions that one can put into place helps to empower people without patronizing or blaming them for their own poverty. And so, if you look at this word picture, it has all of those things that are impacted in reference to someone experiencing poverty. They usually have a lower level of pay, so they're struggling with their finances. Oftentimes they have a background or a minimum education, depending on where the world is, not the world, the nation is, maybe experiencing recession. And so that then double downs and impacts those who are already struggling in poverty. And again, we want to be sensitive when we're working with individuals as to where they are, above or below the poverty line. And with Rehab Your Life being a nonprofit organization, we have a sliding scale fee. And if you fall below a certain percentage of the poverty line, then your services through our program can be free or at minimal cost. And so I wanted to take a little bit of a different spin than normal, because this is not a program that's for children. However, a lot of things that happen to us as children still affect us to this day. So the social and physical environments in which we live, work, and study affect us all, especially children. So when we reflect back on when we were children, what were our social and physical environments? Were we able to get a good education? Did we have a two-parent home? What was that family composition and dynamics like? Were one of our parents or both of our parents incarcerated at times? And what was the family dysfunction that you might have experienced? Or if there was some economic hardship where your mom might have stayed home and your dad worked, and now we have two parent homes where both parents are working oftentimes, or single parent homes, but mom has to work extra just to be able to make up the difference. And then your neighborhood features and resources. There's been so many more planned communities now where within that community you have everything that you need: grocery store, park, community center, etc. But you also still have communities where they don't have that. There's very limited grocery shopping. The Dollar General or Family Dollar may be their grocery stores, if you will, without having to get transportation to go outside of their area. And then also the community identity and cohesion. Do you know your neighbors? Would you be able to count on someone in your neighborhood to come and check on you? What is the crime like in your area? Do you have a neighborhood watch program? All of those kinds of things impact your sense of pride and ownership, or even if you're a renter in that area, just taking ownership of what you are charged with. And so all of those things play a factor in terms of the social determinants of health. So, adverse experiences in childhood can affect an individual's lifelong emotional and physical health outcomes. So, again, I wanted to take a little bit of a spin, but I want to break down what some of those adverse childhood experiences might look like, where you would be able to then identify for yourself if you are still struggling or working through some of those things that have manifested themselves in your adult life, where it actually came from your childhood. So some of those could be abuse and neglect, whether it was physical, emotional, or sexual. Household dysfunction, whether you were experiencing domestic violence, substance abuse, or mental illness. And then how did that impact you? Did you experience some impaired childhood development? It could be something where it's neurobiological effects, psychosocial effects, or health risk behaviors. Most of the time, people fall within those last two categories: psychosocial effects, in reference to, being socialized properly, being able to care for yourself, the self-efficacy properly, or being able to be independent away from your parents. The second one being the health risk behaviors. You smoke because you saw your parents smoke. You're obese because it runs in your family. Diabetes runs in your family. Substance abuse is another one where, if it was not taught that, certain medications should not be abused, or certain drugs should not be taken, like marijuana is, being commercialized now and made available as not a drug anymore. You don't get charges for that anymore in some states. And or being promiscuous. A lot of children, had children at young ages, 13, 14 years old, having babies. So it just depends on what your family dynamic was when you were growing up. You may see a lot of those things in your life now. And so the long-term consequences of those adverse childhood experiences could look like you experiencing disease and disability, such as heart disease, cancer, chronic lung disease, major depression, suicide, PTSD, drug and alcohol abuse, or sexually transmitted diseases. Another aspect of some long-term consequences would be social problems: homelessness, prostitution, criminal behavior, unemployment, parenting problems, and intergenerational abuse. And so just depending on what your environment was like and your childhood experiences really could be dictating how your house is run, how your household is run today, how you're adjusting to living as an adult today. And I think we take that for granted sometimes, that some of those things have truly spilled over. But when you learn to be able to identify those, create an action plan, to be able to improve in those areas, then you can take control of your life. So countering adversity's effects. So, those were the things that you experienced as a child. But now, as an adult, how can you improve and strengthen your health literacy, your access to care, and the quality of services that you receive? And so you want to be able to connect yourself and expose yourself to programs that would be able to help you to improve in these particular areas. And Rehab Your Life is one of those programs. And so the final question is, what does social determinants of health have to do with Rehab Your Life? So again, when you first interact with Rehab Your Life, we put you through what we call the initial discovery call. Basically, it's just a brain dump. You just tell us everything that has been going on and what you're currently experiencing and what you need help with. And so that initial discovery call is just like, this is what I'm going through and this is what I need help with. Then we take that information and we help you to be able to develop a rehab action plan. We work within the 4 pillars, which I'll repeat those, is rehab your career, rehab your money, rehab your health, and rehab your relationships. Not all people need a plan in every area, but depending on what you shared with us and what you truly need help with, you may have a plan that has action steps that will help you to be able to do those things, to rehab your life in those areas. Also, the way that we do things is that we conquer those goals 90 days at a time. So you may do a brain dump, but we're going to sift through those things and identify how you can move forward, how you can make forward progress, how you can get some relief from what you're going through and be able to see the light of day, just 90 days at a time. And it could be where all 4 of your goals are rehab your health related goals. It could be that it's 2 and 2. It just really depends on what you shared with us during that initial discovery call and what we are able to help you with. We do have partners that we work with, so if we are unable to provide you with those resources, we will connect you with another organization or individual that can assist you with that. And then we will help follow along during the 90 days with your rehab action plan, being able to just conquer those goals 90 days at a time. So after the initial 90 days, if you would like to continue working with us, then we would develop a new rehab action plan. And so, there's 4 quarters in a year, and we will just work those quarters until you get to where you want to be. So if you would like to connect with us and be able to learn more about how we can help you develop your rehab action plan, we are at 7171 Highway 6 North, Suite 116 in Houston. Our phone number is 281-849-1307, and our email is rehabyourlife2@gmail.com. Or you can check us out on rehabyourlife.org and click the button to say, yes, I would like to rehab my life. Thank you guys so much for this last part of your lunch. Go ahead and finish your day strong, and I will see you guys next Wednesday.